right, we're going to do 4 horizontal bite wings with tabs now. And so again, just as before, you had your lead apron draped over the chair. So you pick it up, ask the patient to sit down, put it right on them. So we're not going to have a concern that we forget the lead apron. That is a major infraction. We had all of our clean items out. We would actually open up our container for our XCP set if we were using that again. Right now we're going to use tabs. So I have clean tabs out and available. I already have my receptor sensor with a barrier on it. So when you're going to do tabs, and it's a little trickier when you have gloves on, you need to follow the directions on the tabs. They say fold it in half. Your book has a nice picture of this. And place the tab, just like you did the rectangle, in the very center of the words Gendex. You'd like to have equal distance top and bottom on your receptor. The tab is part of the wing, part of bite wings, that has caused these to be named bite wings. Again, I want to start by grabbing my patient. So I pick a patient, start typing in their name, find their name, and use them. I pick my tube head because I am going to make an image. And then I choose what image I'm going to make. And right now, because I know the very next thing I'll do is actually take the image, I'm going to press acquire. We have, this patient has been seated. We make sure we've done our rinse. We again look for our cursory screening. You always look before you leap. You want to know if there's something you need to accommodate when you're in there. Is it a tori? You want to be sure you're doing this as comfortably as possible for a patient. Is there a rotated tooth that I need to consider changing where my sensor or receptor is so that I can clear that contact? All right, again, I would be donned with all of my PPE, personal protective equipment, and I explained to my patient, I'm going to put the sensor right down here, and I even put my finger in to get them all ready for this, so that they know this is where it's going to sit. I do slightly push the tongue out of the way, just to the side. Don't push hard because it pushes back. And then, just as we did before, I'm placing my receptor parallel to the teeth I am working on. Premolars have the same rules. I want the distal half of the most anterior canine, which is usually the mandible. Molars is the very same rule. I want distal bone behind the last molar back. So while I was looking, I said, oh, you actually have a wisdom tooth. Well, we're going to have a little challenge here. And I turn my sensor sideways so it's not so thick. Patients don't have to open so wide, just like I did with the XCP, but it was probably hard for you to see that. And I place it down in the floor of the mouth, exactly where it's going to sit. If someone has a tori, this doesn't feel good sliding over it. So you place it parallel to the teeth you want. The image is on the software, still the premolar will be first. And here's when the patient will bite my gloves, so be prepared. I will hold on to the edge of the bite wing tab. I'm going to do it this way so I don't block your view. And I ask the patient to close slowly, please. Emphasize slowly, your fingers in there. You don't want to be chomped on. And you are holding on to the tab, holding it against the teeth. Some people actually bend and fold it over so that they know it has a crease in it and it will be caught by the maxillary and mandibular teeth coming in contact in occlusion. All right, so now I don't have an aiming device. I need to, again, use my central ray to go right between the contacts. I want them to be a nice open contact. I need to be sure also that I am at my plus 10 degrees. So when we're doing horizontal bite wings, we say plus 10, but it's actually anywhere from plus 8 to plus 10. Nobody takes a protractor to this. You all have to eyeball it, but you do use your gauge on the side. Plus 10 is right there. You can still see that the tube head itself is above the pointing device, so we are at a positive 10. Use my yoke or my arm to move it. And you know what? Sometimes I ask my patient, would you tuck your chin down a little bit, please? Because they've been trying to help me and they kind of lift their chin up. but I want the maxilla parallel to the floor. So if you tuck your chin down a little bit, please, Mr. Smith, and I am working to get that tab right in the center. This is a little trickier because, again, I don't have that aiming device. I do try not to get a cone cut, but I do not fall apart if I get a cone cut, because as long as it's not in the area that I need to cover, I'm going to be okay. I usually bring it in close and aim. Remember that the arch is curved. It's not flat. We're not square. So I can't have it way out here. I need to actually angle it toward the premolars. I'm visualizing a line, central ray, going right through the contacts. So if you'd stay right still, Mr. Smith, I will go and expose this image. I look around to make sure we're all safe. Exposing unit X. Okay, and then I come back in. Mr. Smith often wants to get rid of this, so I will let him open and I will hold it. Not too bad. It covers what it needs to. The contacts are open. I actually have a lot of the molars as well. I would love to have had a little more of the mandibular first canine, but I don't spend a lot of time determining what I should have done now, because I have a patient with something in their mouth. So for the patient, I'm going to say, well, Mr. Smith, I'm going to do your molars now. And molars, again, are a little trickier because I am really trying for distal bone. And if you would, close, please. Don't worry that you're biting me. I'll pull my finger out. Very good. And now I am aiming between molars. Okay, so I'm going to come in by the molars, and again, we're not square or flat, so I have to angle it a little bit. Truly, my mind is thinking, where is that central ray going to go? And I think we're going to be okay. Knock on wood, right? Yeah. Okay, stay right still, please, Mr. Smith. Make sure everyone's out of the way. Exposing unit X. And not too bad, actually pretty good. Kind of surprised myself. So I'm going to take the tube head behind the patient's head and come around to the other side. Remember, please, this is a wired sensor. Don't go walking back there until you have taken this out of the patient's mouth. You're likely to trip on it. And I am going to, I have come to the other side, but there's nothing special I need to do except turn over my sensor. We're still going to use the bite tab. The same thing would have been if with our horizontal bite wings. You don't need to disassemble that XCP. You'll actually just turn it over, making sure the wire is coming out toward the anterior portion of the mouth. If you lose your place and you're not sure what's the next image, look at the software program. It says number 3 is the premolar over here on the left. I have not changed my angulation, but I do double check it, and it is still 10. Because when I moved it, sometimes that does happen. So I will place my image. Distal half of the canine is what I'm aiming for. I asked Mr. Smith to close slowly, please. Don't worry that you're biting my finger. We'll fix that. Smile really big. Can you tuck your chin down a little, please? And I'm aiming for the premolar region. Stay right still, please, and I'll go out and press my exposure button. Make sure you don't walk behind the sensor. Exposing unit X. I'll be right there, Mr. Smith. When you're actually working with the Dexter in the lab, I do ask you to talk to your patient. Patients don't like to just have things done to them. They would love to have you talk to them and explain it. Okay, so now, Mr. Smith, we're going to take our last image, and it will be our molar image. So if you would close slowly, please. Thank you very much. If you would drop your chin a little bit and smile big for the camera. Okay. I'm picturing my central ray going right between those teeth. I'll go out and press the button, exposing unit X. All right, and so this is our last image. Not bad, I got a little more of the maxilla than I did the mandible. Thank you, Mr. Smith. Open right up. We'll have our instructor come and look at these and see if we need any retakes. If we do, we'll do them together with the instructor. And sometimes while I'm waiting, I show the patient their images. Always turn the tube head down so that it is not pointing at you or at the patient in case someone inadvertently were to touch the button out there and an inaccurate exposure would happen. While we're waiting, we'll let you rest. I'll get the instructor and we'll do our paperwork and double check any retakes.